março de 2005, manifestantes reúnem-se em frente à casa de repouso Woodside, em Pinellas Park, na Flórida. Há 5 anos, este é o lar de uma mulher de 41 anos com danos cerebrais irreversíveis. O nome dela, TERRI SCHIAVO. Em 13 dias, TERRI SCHIAVO estará morta. Apelos públicos, ações legais até a Suprema Corte Federal e uma tentativa do Congresso americano de intervir e aprovar uma nova legislação não bastaram. A morte dela marcaria o final de uma disputa familiar entre o marido e os pais de TERRI. De um lado, Michael Schiavo tentando realizar o que ele alega ser o desejo da esposa, não ser mantida viva artificialmente. Do outro, os pais de TERRI, Bob e Mary Schindler, que acreditam que a filha pode se recuperar e estão dispostos a assumir a guarda de TERRI para cuidar dela. A situação de TERRI SCHIAVO alarmou o mundo, chamando a atenção para um tema que toca o coração e a alma da humanidade, provocando um debate global sobre como as pessoas vivem e a forma como elas morrem. TERRI. Era assim que parentes e amigos a chamavam. Teresa Marie era seu nome de batismo, a primogênita dos 3 filhos de Bob e Mary Schindler. TERRI e os irmãos cresceram num bairro residencial da Filadélfia. Ela terminou a escola e foi estudar numa faculdade local onde conheceu Michael Schiavo. Eles se apaixonaram, casaram e se mudaram para a Flórida para ficar perto dos pais de TERRI, que tinham ido morar lá por causa do clima mais ameno. Michael trabalhava como gerente de restaurante. TERRI era secretária de uma empresa. Então, 5 anos depois do casamento, nas primeiras horas do dia 25 de fevereiro de 1990, TERRI sofreu o que os médicos chamariam mais tarde de colapso causado por deficiência de potássio. O coração de TERRI parou de bater e ela ficou sem oxigenação durante pelo menos 6 minutos, antes dos paramédicos ressuscitarem-na. O incidente a deixou com danos cerebrais graves e possivelmente irreversíveis. Os pais travaram uma batalha pela vida de TERRI SCHIAVO. Desde 1990, ela passou a viver no que os médicos chamam de estado vegetativo persistente, EVP. Segundo eles, TERRI não sabe o que acontece à sua volta e não é capaz de se comunicar, nem reagir de forma consciente ou intencional. Mas os pais de TERRI insistem veementemente que a filha não está em estado vegetativo persistente. Com danos cerebrais e gravemente incapacitada, sim, mas permanentemente não. Bob e Mary Schindler e o marido de TERRI, Michael, travam uma batalha para determinar se TERRI deve viver ou morrer.
It's murder, and it's murder. The blood is not only on the judge's hands, it's on the husband's hands, and it's on the attorney's hands. Because I'm telling you, this is all contrived. And make no mistake about it. It'll be legalized murder.
My client wishes TERRI would get up tomorrow. I mean, he has no interest in preventing her from getting better. He'd be the happiest man on earth if his wife could get better. His interest is following her wishes, and if he had any any credible reason to believe she can get better, believe me, he'd be the first one online to try it.
We cannot, as a society, kill people simply because they're too disabled to suit us. We can't do that. We're better than that.
Terry passou os últimos 5 anos da sua vida internada nesta casa de repouso em St. Petersburg, na Flórida. Alimentada através de um tubo inserido em seu estômago pelo abdômen. Michael Schiavo insiste que a mulher jamais quis viver assim e, para honrar seu desejo, quer desligar o tubo de alimentação. Terry respira sem o auxílio de aparelhos e, segundo pelo menos um médico, não está sofrendo nem corre risco de morte. A única coisa fora das causas naturais que mataria Terri Schiavo seria a falta de comida ou bebida. Sem comida ou bebida, os médicos dizem que Terry levaria entre 10 e 14 dias para morrer. O caso de Terry provocou muitas emoções. Um lado diz que a suspensão da alimentação equivale à eutanásia. O outro lado defende que ela não tem chances de se recuperar e que o desejo da própria Terry nessas condições seria morrer. Essa é uma história cheia de complexos dilemas éticos e morais. O que é certo e o que é errado. Não apenas para Terri Schiavo e sua família, mas para milhares de pessoas e famílias que enfrentam problemas parecidos.
The problem cases are those in which the people closest to the patient don't agree on what would be respectful and dignified treatment. And that seems to be the case in Florida.
End-of-life issues are very complicated because there are a lot of issues, end-of-life issues, certainly in intensive care units, where we have created a no-person zone. Technology has created a zone that nobody knows what to do with. And consequently, we have bunches of inexperienced, untrained, ethically untrained people making life and death decisions on technical terms alone and getting into all kinds of trouble. Having fights with families, making the family into the enemy.
But one of the issues, of course, is who is paying for the care that she needs. Would she be a burden to them if they had to provide 24-hour a day, 7-day a week, 52-week a year care for her without the support of medical services?
This is one of those ironic cases where so-called medical progress has created an ethical dilemma of a kind that simply would have been non-existent earlier.
What are your impressions?
As divergências em relação ao fato de Terry estar ou não em estado vegetativo persistente e dela querer ou não viver, dependendo das máquinas, são tão intensas e duradouras que o destino final de Terri Schiavo será decidido pelo sistema judiciário da Flórida. Até agora, após uma batalha judicial que já dura anos, o tribunal concordou com Michael Schiavo que Terry está em estado vegetativo e que não ia querer viver nessas condições. Um juiz chegou a determinar que o tubo de alimentação fosse retirado para que Terry morresse. Após quase 3 dias sem comida e água, a ordem foi cancelada. Agora, este tribunal de apelação está analisando o caso.
May God save the United States of America, the state of Florida, and this honorable court.
A luta para manter Terry viva tem 2 questões centrais: se ela realmente está em EVP e seu suposto desejo de não querer viver nessas condições.
She exhibits responses. She exhibits that reaction every time her mother first comes in the room. She has been medically sequestered, socially isolated. She's not been given a chance to get better, and that to end her life under these circumstances is nothing less than murder.
In respecting her dignity, what Terry has left is for us to respect her free will, her choice. In this case, in a legal sense, is a case to enforce her constitutional right to refuse unwanted medical treatment. It's a case to enforce what the court has determined to be, by clear and convincing evidence, to be Terry's wishes. We give our express plea to the court to give a very definitive opinion, to circumscribe, according to the law, what the law of this case should be. So we finally give her the respect that she's entitled to have her decision carried out.
None of them said that she's in imminent danger of death. And you know, the fact that she can't bring a spoon to her mouth should not be a death warrant. You have to err on the side of life.
A morte é parte natural e inevitável da vida. Apesar de nenhum de nós ser capaz de evitá-la, a morte e a ocasião da morte mudaram. Há 50 anos, morrer era relativamente simples. Naquela época, se alguém não estava morto, estava vivo. Morrer era morrer, viver era viver. Foi apenas nos anos 50 e com mais frequência nos anos 60 que as pessoas começaram a morrer em hospitais. Antes disso, a maioria morria em casa, cercada por parentes. Raramente havia médicos diretamente envolvidos na experiência da morte. Hoje, isso é bem diferente. Como a medicina moderna salva heroicamente mais e mais vidas, cada vez mais pessoas como Terri Schiavo recebem o diagnóstico de alguém em estado vegetativo persistente. Então, o que é exatamente isso? O estado vegetativo persistente é uma condição clínica de inconsciência completa de si e do ambiente, resultado de danos cerebrais que causam a perda de todas as funções do córtex cerebral. O estado também é acompanhado por ciclos de sono e vigília. Sem dúvida, o diagnóstico desse EVP é vago e duvidoso. Não é categórico como um diagnóstico de câncer ou diabetes. O diagnóstico errado é comum. Segundo um estudo, em até 40% dos casos, o diagnóstico de EVP é equivocado. O juiz da Flórida, George W. Greer, determinou que, apesar de Terri Schiavo ser vista reagindo a comandos, as reações dela eram muito pouco frequentes para que se concluísse que Terri não está em EVP. Mas a dúvida persiste. Ela está em EVP e inconsciente ou está consciente com danos cerebrais graves?
Well, I understand, informally at least, the persistent vegetative state to be a situation where the higher brain has been effectively destroyed. There is still lower brain activity, but the higher brain, that is the cortex, which is the seat of our thinking and our rational nature, is totally gone, and the patient still has some brain activity, so is not totally dead.
Persistent vegetative state is a statistical statement. It's a statement of classification. All classifications have edges that are not that or more than that. So that's one. It's not a fact like the temperature. It's an opinion based on a set of criteria which this patient probably doesn't entirely meet.
There is no objective test that will tell you the patient is not conscious. So what the doctors do is they do these various neurological tests, and they make a judgment about whether these reactions are reflex or conscious.
Normally when we talk about a disabled person, we're still talking about somebody who is a person in some meaningful sense of that term. Namely, they have the ability to think, they have the ability to interact with others, they're aware of themselves, and that'd be the most worst, some quadriplegic. I mean, they can think, they can have feelings, they relate to other people, they can be severely disabled, or even people who were in the old days when they had iron lungs, but for polio. They were just lying there, you know, totally immobile. But they were still, and they were surely as disabled as you could get, but we still consider them persons because they retain the quality. Now, persistent vegetative state, apparently, if it is truly that, you have lost all real potential to be what we would want to call a person.
It's really more helpful to ask, is there a meaningful level of life for her at this point? Is she able to communicate with the family? Can she receive love in a way that would mean something to her? Not just be meeting her parents' desires or someone else's desires to see a human response, but is there meaning in it for Terry herself, for the patient herself?
A lei da Flórida define o estado da seguinte maneira: o estado vegetativo persistente significa uma condição permanente e irreversível de inconsciência, na qual há ausência de ação voluntária ou comportamento cognitivo de qualquer tipo, e a incapacidade de comunicação ou interação intencional com o ambiente. No caso de Terri Schiavo, os dois lados estão se concentrando em palavras diferentes para apoiar suas justificativas. Pat Anderson, advogada da família Schindler, defende que, segundo a lei, o estado vegetativo é a ausência de qualquer tipo de comportamento. Ela argumenta que o juiz do primeiro julgamento, George W. Greer, interpretou mal a lei porque Terri reage ao ambiente.
After the testimony of 6 physicians, Judge Greer found that she exhibited a few voluntary or cognitive behaviors, but that those behaviors were not consistent or reproducible. Therefore, she remains in PVS. My argument is that judgment misapplies Florida law, and standing alone, if he found voluntary behaviors as a matter of law, she cannot be in PVS, and he and any other judge in Florida is totally without jurisdiction and authority to end her life.
George Fellows, advogado de Michael Schiavo, diz que Terri não age intencionalmente e, portanto, se encaixa na definição de estado vegetativo persistente. Segundo ele, no contexto médico, a palavra intencionalmente é definida como uma reação cognitiva, algo que tem significado.
Patients in a persistent vegetative state do laugh, they moan, they cry, they make bodily movements. They have these type of reflexes. Hi. And so, yes, because a patient exhibits those doesn't mean they have cognition. But I wanted to say this too. It doesn't make any difference as far as carrying out her intent. Even if Terri had minimal consciousness, her intent was not to be kept alive in this situation, and her wishes should be carried out.
Almost all religious traditions agree that life is not the highest value, that the highest values are the values that life is there to sustain. So life is there to sustain values such as love or charity or the doing of justice in the world or being able to communicate and care for another. If those values are not being served by life, then life itself is not the highest value, and we are not morally obligated to do everything in the world to sustain life.
There's a clearly defined right of a otherwise competent patient to say no to treatment, to say, I don't want to be kept alive, and walk out of a hospital and say, I don't want that operation, sounds awful, goodbye. Or you can tell the doctor, I've had enough of this tube feeding, take the tube out, let me die. If you're competent, the law will support you doing that. Now, beyond that, the difficulty is, of course, what if you're not competent? What if you're unconscious? Then the family has to decide, and there's often debate about how you should pull that off, too.
Vegetativo persistente, as dúvidas continuam. Michael Schiavo não concordou em ser entrevistado para o programa, mas ele declarou que, desde o colapso de Terri em 1990, ela nunca reagiu a um simples comando, a nada. No entanto, exames ordenados pelo tribunal contestam isso. O maior problema do diagnóstico de EVP continua sendo sua natureza subjetiva. Médicos diferentes podem ter opiniões completamente distintas.
She's in a permanent vegetative state to the highest degree of medical certainty. Highest degree of medical certainty. There's no chance for recovery. There's no chance of any therapy being valuable to her.
The definition is that a patient has no responsiveness or no responsiveness of any sort to the environment around them. So, no, she's not PVS. She looks at people, she looks around, it's obvious that she's responding to her mother. So she's already got a cognitive process going on.
You feel better? What? What? What?
All right, okay. Thanks very much.
Ron Cranford é um conceituado neurologista de Minneapolis. Ele depôs como testemunha especialista em cerca de 12 casos de eutanásia nos Estados Unidos. Estas são imagens do exame de Terri Schiavo, que foi instrumental na determinação do tribunal e na confirmação do diagnóstico de EVP.
My examination, mainly, when you examine a patient like this, see if they have visual pursuit, see if they follow with their eyes. So when you walk in that room and you look at Terri and she doesn't follow you with her eyes, which she didn't, that by itself was a strong indicator that she's not aware. Because almost always the first sign is visual pursuit and or visual fixation. When they look at you and they follow you, consistently and reproducibly. And so if she did that, if she came out of the vegetative state, it would be something that would be obvious to you or me to anyone. She didn't have any of that.
Como parte do exame, o Dr. Cranford pediu que Terri acompanhasse o movimento de uma bola de encher.
Can you see that? Okay. All right. Look over here. Look over here. That's fine. Look over here. Okay, look over here. That's it. Look at there. Now come on over here. Now come on over here. Oh, you see that, don't you, huh? You do follow that a bit, don't you, huh?
Apesar de Terri parecer seguir a bola e dos elogios do doutor ao cumprimento da tarefa, mais tarde ele declararia que Terri, sem dúvida, estava em estado vegetativo persistente.
2 or 3 times it looked like she tracked for a few seconds. And I think she probably did track for a few seconds. But that's not seeing. That's a brainstem hypothalamic mediated reflex. Because it's well known that patients in a vegetative state can do certain things which look scary. And one of them is now and then they can track for a few seconds. That's just a visual orienting reflex.
Quando perguntado por que elogiou a capacidade de Terri acompanhar a bola, o Dr. Cranford disse que elogios fazem parte da rotina.
I talk to the patient when I do that, whether vegetative or whether minimally conscious or whether demented. I think it's just decency to do that. It's routine for me to do that. I do that all the time.
William Ramsfar também é neurologista. Ele administra o Instituto Neurológico Ramsfar em Clearwater, Flórida, e soube do caso de Terri pela televisão. Ramsfar também examinou Terri e não tem dúvida de que ela não está em estado vegetativo persistente.
She's partially blind. She has probably a spinal cord injury. She has tremendous difficulties with speech. She really can't speak at all, although she can make sounds and make sort of an early type of speech. In neurology, it's a very common thing that if a person has a brain injury, that at times they will give you the response you want, and at other times they won't give you the response you want. None of us across the day do consistent and reproducible interactions. She actually has fairly reproducible interactions by almost any neurologist's standards.
Existem critérios objetivos para se diagnosticar o EVP, mas determinar se um paciente se encaixa em tais critérios depende de opinião subjetiva e polêmica. Alguns críticos não aceitam o uso do termo vegetativo, argumentando que ele implica uma classe diferente ou inferior de ser humano. Essencialmente, pacientes em EVP parecem estar num estado intermediário entre a vida e a morte.
Good job, young lady, good job.
Parte do argumento para retirar o tubo de Terri é que, segundo alguns médicos, ela não tem chance de recuperação. Outros defendem que o mesmo poderia ser dito sobre pacientes que têm mal de Alzheimer ou que sofreram derrame. Eles também não têm chance de se recuperar, mas devem deixar de ser alimentados por isso? A qualidade de vida deles é tão horrível a ponto de serem condenados à morte?
I reject the idea that someone who is in a wheelchair or someone who has to have renal dialysis and spends many hours a week hooked up to machines somehow doesn't have an acceptable quality of life. Many of the people that I know who have serious disabilities are some of the most amazing people I've ever met. And we've learned that in part from people with disabilities, people who have HIV disease or full-blown AIDS and know they don't have much time to live, often gain an amazing kind of spiritual quality to their lives. So I don't like the phrase quality of life because I think it's often a judgment that we make about other people without really looking hard at all of the dimensions of human life and what it means to say that a life has quality.
Bob e Mary Schindler são os primeiros a admitir que, imediatamente depois do colapso de Terri, eles e Michael se uniram para conseguir o melhor tratamento disponível para Terri. Michael, inclusive, se mudou para a casa dos Schindler com Terri, para que ela tivesse ajuda às 24 horas do dia. A certa altura, todos levaram Terri à Califórnia, onde ela fez um implante experimental no cérebro, o que acabou não surtindo efeito. Mais tarde, segundo os pais de Terri, tudo mudou. Foi quando Michael processou por negligência um médico que não diagnosticou a deficiência de potássio da mulher e recebeu indenização de $1 milhão.
Prior to the malpractice award, it appeared that her husband had her interest at heart. And we worked in harmony trying to help her. And after the money was awarded, then it was a completely different story.
Everything changed. He told, he told us we couldn't see her anymore. It was his wife.
He'll make the decision.
He'll make the decisions. And we were cut out of her life from that day.
Really the fact that Terry's had no help, when Michael had promised that he was going to help her and received the money to help her, and now is using the money to try and kill her. That's probably one of the most upsetting, and our family is handcuffed. We can't do a thing for Terri.
A disputa aumentou quando, menos de um ano depois, Michael impediu que Terri fosse tratada de uma infecção no trato urinário. Os médicos alertaram Michael que, se não tratada, a infecção levaria à morte dela.
She required an antibiotic to treat that, and he instructed the caretakers not to administer any type of, antibiotic for her, and knowing full well, and he admitted it later in a deposition, that it would be fatal. He was told it would be fatal.
It was her treating physician that had suggested to Michael, don't treat the infection. If you don't, Terri will die. Has no cognition. She's in a vegetative state. I've been telling you for years now that there's no hope. Why don't you face up to reality and let nature take its course?
Mas um grupo de enfermeiras interveio e tratou a infecção. Nessa mesma época, Michael informou ao Schindler que, em certa ocasião, Terri manifestara o desejo de não querer ser mantida viva artificialmente. A alegação foi confirmada pelo irmão e pela cunhada de Michael e se tornaria a prova clara e convincente de que o tribunal precisava para conceder a autorização de desligar o tubo de Terri. Os Schindler acham a prova suspeita e insistem que ela foi resultado de uma armação.
No, I don't think it's suspicious, and the court didn't find it suspicious. It's common and natural that the statements that someone would make about that subject would be made to those close to them.
It's ridiculous. It was not in the character of my sister. My sister and I used to go visit my grandmother, who was in a nursing home. She was in her late 70s. And you know what nursing homes were like. All around us there was elders, and they were in deteriorating
shape, and their lives were, you know, close to being over. And Terry never, at any time, said anything to me about wishing or wanting to die if she was ever in any type of situation.
And the fact that those are the types of comments that Terry made to her closest family members, I think buttress their credibility.
You know, it wasn't only us that she never said anything to. Her closest people she worked with and her closest friends from up north never heard Terry ever say anything about her end-of-life wishes, never.
Apesar do juiz Greer ter decidido que a prova é clara e convincente de que o desejo de Terry era não viver nessa condição, a verdade é que ninguém sabe de fato qual é o desejo dela. Talvez ela não esteja pronta para morrer. E qual seria o desejo dela hoje? Vários estudos mostram que pacientes mudam de ideia em relação à vida quando se tornam incapacitados.
Will say all sorts of things about what they wouldn't want to end their life with machines and tubes and all that stuff. And I wouldn't want to spend my life in a wheelchair. I'd rather be dead. But in fact, they get injured, they get hurt, and they end in those states. And basically, they turn out to prefer being in the wheelchair and being disabled than being dead. And this happens again and again with people.
The prior statements that we make about that are not always trustworthy because our experiences and our feelings change when our capacities change. And we may, in fact, discover a meaningfulness in life that we never could have anticipated. And if you talk to people with different disabilities or read widely in the disability literature, as I do, you'll find that a lot of people who once upon a time said, I would never want to live with this limitation, suddenly discover I can live with this, and in fact I'm finding new meaning and new value in my life.
And how can you know what's best for that person? Well, you can't. We're so complex. We're so different. Each of us is different, same in some ways, but different, that knowing what's best for somebody else becomes extremely difficult.
But I am not myself convinced that the patient's desires should be overriding in all cases. It seems to me that that view of patients really rests on an assumption that we are somehow completely isolated and separate human beings who don't need each other and don't live in community. And by contrast, I think all of us live in families, in communities. We live embedded in a social context, and that the entire family context needs to be considered, not just the wishes of the patient. So I have to say truthfully, for me, the overriding consideration would not be what does this patient want, or what did this patient say she wanted at a point where she could communicate her wishes.
Estima-se que Terri Schiavo seja uma entre até 35 mil pacientes nos Estados Unidos diagnosticados em EVP. Mas a dúvida em relação a quantos desses pacientes podem ter sido diagnosticados equivocadamente persiste. Enquanto os dois lados continuam lutando pelo que acreditam ser certo, algumas perguntas continuam sem resposta. Uma das maiores dúvidas em relação a Terri Schiavo é se ela tem chance de melhorar através da fisioterapia. Ainda se discute calorosamente sobre a quantidade de fisioterapia que Terri recebeu desde sua parada cardíaca em 1990. Segundo a família, praticamente nenhuma. O advogado de Michael diz que isso não é verdade, mas o fato é que nos últimos 5 anos ela não recebeu fisioterapia. Casas de repouso simplesmente não oferecem fisioterapeutas para pacientes terminais. O objetivo dessas instituições é cuidar de moribundos e não reabilitar quem tem chances de se recuperar. Ninguém sabe como e se Terri reagiria a um regime intensivo de fisioterapia. As opiniões dos médicos são contraditórias e controversas.
She should have rehabilitation, but there's no point in it. Why would a speech and language pathologist come in to a patient who has no chance of recovery and try speech and language?
The odds are overwhelming that she can be helped by any number of therapies. It used to be thought that when a person had a brain injury that there would be improvement in the first 3 to 6 months or maybe 9 months after the injury. And then after that, the odds of improvement were very slight. But that was before we had technique to increase blood flow into the brain and into those damaged areas.
That's just shameful. That's just disgraceful. I don't know how he can say that in court and speak publicly. He's...
Durante os exames encomendados pelo juiz, o Dr. Ramsfar conseguiu esticar o braço esquerdo de Terry quase completamente. Em seu depoimento no tribunal, ele disse que acha que poderia ajudar Terry fisicamente e ainda reverter alguns de seus danos cerebrais.
A SPECT scan is a nuclear medicine study that looks at brain tissue and can identify brain tissue from scar tissue. And in her case, it showed evidence. She had evidence of quite a bit of brain tissue, maybe 70 or 80% of normal amount of brain tissue is present in her skull. When blood vessels are injured in the brain, they narrow and cut off some of the blood flow to the brain. When the blood flow gets cut off to the brain either becomes injured or it becomes partially injured. And what we're really doing is trying to increase the blood flow through those damaged blood vessels back into the brain to get healing to go on.
A terapia se chama vasodilatação. É tratamento não invasivo com remédios comprados em farmácia. O Dr. Ramsfar diz tê-la descoberto tratando pacientes de derrame que sofriam de enxaqueca. Mas o médico admite não ter publicado nenhum relatório sobre o suposto sucesso de sua terapia, particularmente em pacientes em EVP.
Well, no, we don't have published statistics on patients in PVS. We have a small number of videotapes of patients who have been in PVS. Most of our patients had no changes in their neurological condition, their brain injury, their stroke for several years before we started treating them, sometimes out to 20 years.
To think after 12 years she has any chance of recovery, let alone the treatment they're using and suggesting the vasodilator therapy and the hyperbaric oxygen is bizarre and bogus and fraudulent at 12 years out.
And within 3 weeks, over 90% of patients had major neurological improvement, either identified off of psychological testing, which meant that they were aware and alert and following ideas and thoughts, or off of physical therapy testing, and usually off of both areas. About 40% of people had what's called functional improvement in that they could do new things around the house that they couldn't do prior to starting treatment.
People come along and tell this family that she can improve is just brutal, shameful medicine.
What that means is that no matter when the injury occurred in a stroke or a brain injury or a cardiac arrest or coma, when it's neurological or a spinal cord injury, no matter when it occurred, there remains an area of neurological tissue, of brain tissue or spinal cord tissue that can improve even years down the road.
Jeffrey von Wattenfeld foi ferido num acidente de carro em 2004. Ele sofreu traumatismo craniano e os médicos disseram aos pais de Jeffrey que ele jamais voltaria a andar ou falar. Disseram que só um milagre faria o rapaz voltar a ser o que era antes, mas o tratamento do Dr. Ramsfar está dando resultado.
Within 2 months of first treatment, he started talking, and his tone and spasticity decreased by about 80%.
You know, about 2 months ago, the state of Florida concluded a many-year investigation on our therapy, and the judge ruled that I was the first physician in history to treat patients successfully to restore deficits following stroke.
No caso de Terri Schiavo, os exames gravados parecem indicar que ela tem reflexo de sucção, o que seus pais alegam ser um sinal de que ela pode ser alimentada e mantida viva sem o auxílio de aparelhos. Em sua primeira ordem para suspender o tubo de alimentação, o juiz Greer não permitiu que se testasse se ela poderia ser alimentada pela boca.
Judge Greer said, I don't want that girl fed.
I mean, we could give her a little bit of pudding or something if we were allowed to see if she could swallow, but I can't do anything. When they brush her teeth, she swallows all the water and stuff that, you know, or...
From what I've been told, she consumes all of her saliva.
She doesn't drool.
At all. She
Does not drool.
For years. I've been advised by people that if you feed someone like Terri who hasn't had any type of oral intake, if you feed them liquids, they'll have a difficult time with that. You have to give them something that is more or less like a...
The problem is going into your lungs. It can go into their lungs.
They're going to aspirate.
And aspirate.
So we're afraid...
Well, we wouldn't do anything.
To do that without medical supervision, first of all. I'd be scared to death to do it.
I would never do that.
For a court to say, withdraw the feeding tube and don't try to spoon feed, that would be unusual. and I think somewhat controversial, unless it's based on medical statements that if we try to do that, she'll swallow it and aspirate it.
The real issue may be, can she be sustained without a feeding tube? If she can be sustained without a feeding tube, what would be the reasons that we wouldn't do that? They would surely have to focus on her own well-being and on the burdensomeness to her or to her family of trying to sustain her in that way. If the family wants to try to take her home and feed her by mouth and see if they can manage that, it seems to me that's a very legitimate request on their part, unless the judge has determined that there is something about her life that is too burdensome.
If the parents are willing to take care of this woman, and they have the means, and they're not going to scarify her or, you know, light cigarettes on her tummy or something like that, they're real. It's like when somebody dies, who counts most, the person that died or the survivors? Are we concerned in end-of-life issues by survivors? Of course we are. Because when somebody dies, where's the pain? It's in the survivors. Could you mitigate that, make it better for them, make life better? If you can, should you? Is that important in end-of-life care? I think it is.
I am personally inclined to agree that if we are to err, we should err on the side of preserving life. I think it is better to preserve life even if we cause some burden or pain to someone by doing that, than it is to make a snap judgment that life is not meaningful to a person. So if I were to err, I would choose to err on the side of preserving life.
O Schindler tem outro argumento igualmente válido. Eles estão dispostos a assumir a guarda de Terry para cuidar dela pessoalmente. Mas Michael Schiavo não quer abrir mão da guarda da esposa, porque se concordar, os Schindler não cumprirão o desejo de Terry de deixá-la morrer. Moralmente, a maioria das autoridades acredita que quem se dispõe a cuidar de alguém como Terry deve ter o direito de fazê-lo. Vejamos o caso de Jenny Austin. Em 2003, durante sua primeira semana de aulas na faculdade, Jenny Austin foi gravemente ferida quando um caminhão de lixo bateu no carro em que estava. Quando os paramédicos chegaram, Jenny não estava respirando. Eles trabalharam rápido e conseguiram ressuscitá-la, mas nem toda a tecnologia médica foi capaz de reverter os danos cerebrais que sofreu. Hoje, Jenny mora com sua mãe, Sandy, e seu padrasto, Chuck Albrecht. Apesar de não ter recebido o diagnóstico de alguém em estado vegetativo persistente, a mãe dela acredita que este seja o seu caso.
I don't want to say that she's never going to get better, because there's lots of new things coming up. But I do know that Jenny is very much in a vegetative state. They think that she'll be in this condition or worse in the years to come.
They tell us that the atrophy in the extremities is just going to get worse. There won't be any improvement.
Como Terri Schiavo, Jenny é alimentada artificialmente através de um tubo. A vida dos Albrecht não é fácil. Apesar de terem um enfermeiro que ajuda em casa, Jenny é como uma criança que precisa de atenção constante.
You have to take care of her in every aspect as if she is an infant child. 24 hours a day, 7 days a week.
We're tired a lot. We're exhausted. It's really hard on us. We cannot just up and leave when we want to. We have to make sure that somebody is here all the time.
Drool all over me, Jenny.
Aparentemente, o estado de Jenny é pior do que o de Terry. Jenny reage, mas não tão rapidamente quanto Terry parece reagir. A outra diferença é que Jenny tem tutores que querem cuidar dela. Parar de alimentá-la para que ela morra nunca foi uma opção.
There's no way I could ever let her go, unless it's good Lord willing. I can't starve her. She's a part of my life. She's very much a part of our lives. I just could never do that. She's a living, breathing creature. Jenny's a big part of my life.
No final das contas, trata-se de uma batalha por uma vida. De um lado, o marido de Terry luta pela morte da esposa. Do outro, os pais de Terry lutam pela vida da filha.
My client is an extraordinary man. I have no doubt that this is a man who deeply loved and deeply loves his wife.
He's pretty dedicated to her death. He is the only one who knows in his heart why he is doing this. Nobody begrudges his wanting to get on with his life. He's a young man. He's only 38 years old. He has a child now with this longtime girlfriend. But he doesn't need to kill Terry to get on with his life. He can just divorce her and get on with his life. He could turn the guardianship over to her parents.
Unfortunately, I think this case has become more a question of ideology than a question about Terri Schiavo. I think that is a disservice to Terry, and it almost has pushed Terry off to the side in this case, and the case is now being waged on the battlefield of ideology.
I think that this is a thought-out plan to use Terry as a pawn and use her as an attempt to further a political agenda that allows euthanasia in this country.
It's not a feeding tube issue. It's a question of whether Terri Schiavo should be allowed to live or die. So it isn't a causing death or making her die. It's a letting her die by stopping treatment.
This case is about getting a person off of a death sentence. And this case is about saving her life, and hopefully there will be an extension from this case, which is safeguards will be put in place to prevent this happening to other people.
It's a right to die propaganda. It's textbook 101. And what you do is you get the public to accept that the person who they're going to, I say, murder, isn't suitable to live. That's exactly what they did with Terry.
Ladies and gentlemen, the Florida Supreme Court. Please be seated.
Quando a batalha legal chegou à Suprema Corte da Flórida, em agosto de 2004, o tubo de alimentação de Terry já tinha sido retirado 2 vezes. A primeira por 2 dias em 2001 e a segunda por 6 dias em 2003.
The legislature has given the power to any person in the state of Florida to raise the question of the rights of a vulnerable adult.
Da segunda vez, o tubo de Terry foi reinserido depois que Jeb Bush, governador da Flórida, e o poder legislativo do estado se apressaram para aprovar o que ficou conhecido como a Lei de Terry. A lei tornava ilegal a suspensão de alimentação artificial de alguém como Terry, que não manifestou por escrito seu desejo de não ser mantida viva artificialmente. Este tribunal acabaria determinando que a lei de Terry era inconstitucional e que a decisão do tribunal não poderia ser derrubada pelo legislativo. Essa decisão abriu caminho para a retirada final do tubo de alimentação de Terri Schiavo. Nem mesmo uma lei aprovada pelo Congresso americano, inúmeras audiências diante de um tribunal federal, uma Corte Federal de Apelações e a Suprema Corte Americana bastaram para que o tubo fosse reinserido.
Of Terry's law too. This young woman has a right to have her full education.
Thank you very much.
Terri Schiavo morreu nessa casa de repouso na manhã de 31 de março de 2005. Sua morte serviu para inflamar ainda mais os debates. Muitas questões ficaram sem resposta. Haveria a obrigação moral de fornecer nutrição e hidratação a Terri, mesmo ela estando em estado vegetativo persistente? Os tribunais tomaram suas decisões com base em depoimentos que apoiavam o diagnóstico de EVP. Há ainda uma outra questão. Terri Schiavo não seria meramente um ser humano incapacitado e merecedor dos cuidados mais básicos, como alimentação e água?
Find me one stripper named Amber Hardig. Or not, okay. Non-stripper names. Desiree, Bambi, Candy Cane.
Max. Maxine. Max Hardig. It's a cute name, isn't it?
If you're a professional boxer, maybe.
Can you believe we made this little creature?
No, it's incredible.
It's the most amazing thing we've ever done.
I almost ran the marathon last year.
If we're lucky, you won't inherit your daddy's sense of humor.
Hello. Say hi to Bear.
She hasn't even eaten anything while she's spitting up.
Well, honey, we can't bug them again. Okay, okay.
Sorry, it's our first kid. We're both a little panicky, I guess.
Well, you gotta ask the pediatrician next time. I just deliver him. She spitting up?
Yeah, I'm second time in an hour.
You lived underwater for 9 months. You'd have a lot to spit up, too.
Something wrong?
A little lethargic.
Well, we didn't think.
She's hot.
Is she,
Hey, you season, get the crash cart!
What's wrong?
Some help in there!
Oh, God. Is she all right? Audio access?
No, Evan.
What's going on?
Estamos apresentando House.
The MRI is back.